Hello and welcome. Today we'll be exploring a rare and complex autoimmune disorder called autoimmune enteropathy, or AIE. This condition primarily affects the gastrointestinal tract, leading to chronic inflammation and malabsorption. Join us as we delve into the causes, symptoms, diagnosis, and management of this challenging disease. The exact cause of autoimmune enteropathy remains largely unknown, making it a subject of ongoing research. However, it is believed to stem from a combination of genetic predisposition and environmental triggers. In individuals with AIE, the body's immune system mistakenly identifies components of the intestinal lining as foreign invaders. This leads to an autoimmune response where the immune system attacks and damages the cells lining the small intestine, particularly the enterocytes, which are responsible for nutrient absorption. Specific genetic mutations affecting immune regulation are often implicated, and these mutations may increase susceptibility to environmental factors, such as infections or dietary antigens, which could then trigger the autoimmune cascade. Now, let's understand the pathophysiology. In AIE, the immune system's attack on the intestinal lining causes severe inflammation and damage to the enterocytes, goblet cells, and other crucial cells of the gut. This damage disrupts the normal structure and function of the small intestine, resulting in villus atrophy, where the small finger-like projections that line the intestine, called villi, become flattened or disappear. Villus atrophy dramatically reduces the surface area available for nutrient absorption, leading to malabsorption of essential nutrients, including vitamins, minerals, fats, and proteins. The inflammation also causes increased intestinal permeability, often referred to as leaky gut, which allows undigested food particles and bacteria to cross the intestinal barrier and further activate the immune system, perpetuating the autoimmune cycle. This complex interplay of immune dysregulation, inflammation, and impaired absorption underlies the debilitating symptoms of AIE. Autoimmune enteropathy is a very rare condition. Its exact prevalence is difficult to determine, but it's estimated to affect a small number of individuals worldwide. It can occur at any age, but it's most frequently diagnosed in infants and young children, often before the age of 2. While it affects both males and females, some studies suggest a slightly higher prevalence in males. Due to its rarity and the overlap in symptoms with more common gastrointestinal disorders, AIE is often underdiagnosed or misdiagnosed, highlighting the need for increased awareness and specific diagnostic testing. The signs and symptoms of autoimmune enteropathy can vary in severity and presentation, but they typically involve chronic gastrointestinal issues. Common symptoms include persistent and severe diarrhea, often watery and voluminous, leading to dehydration. Malabsorption of nutrients results in weight loss or failure to thrive in infants and children. Patients may also experience abdominal pain, vomiting, and fatigue. Due to nutrient deficiencies, other symptoms can arise, such as anemia from iron deficiency, skin rashes or dermatitis, and edema due to protein loss. The severity and combination of these symptoms can significantly impact the patient's quality of life. Diagnosing autoimmune enteropathy requires a comprehensive approach, as its symptoms can mimic other gastrointestinal disorders. The diagnostic process typically begins with a thorough medical history and physical examination to assess the patient's symptoms and overall health. Stool studies are performed to rule out infections and evaluate fat malabsorption. Blood tests can help identify anemia, electrolyte imbalances, and markers of inflammation. The key diagnostic test is an endoscopy with biopsies of the small intestine. Microscopic examination of the biopsy samples reveals characteristic features of AA, such as villus atrophy, increased immune cell infiltration, and damage to the intestinal lining. Additionally, specialized antibody tests may be used to detect autoantibodies, such as anti-enterocyte antibodies or anti-goblet cell antibodies, which further support the diagnosis. It's also essential to rule out other causes of villus atrophy, such as celiac disease or giardiasis, before confirming the diagnosis of autoimmune enteropathy. Autoimmune enteropathy isn't typically categorized into distinct types, but it can present with variations in the severity and specific autoantibodies involved. Some patients may have more severe villus atrophy and malabsorption compared to others. Furthermore, the presence of specific autoantibodies such as anti-enterocyte antibodies, anti-goblet cell antibodies, or anti-brush border antibodies can help characterize the specific immune targets in individual cases. While these variations do not define distinct subtypes, they can influence the clinical presentation and potentially guide treatment strategies. The primary goal of treatment for autoimmune enteropathy is to suppress the autoimmune response, reduce inflammation, and improve nutrient absorption. Immunosuppressant medications, such as corticosteroids like prednisone or methylprednisolone, are often the first line of treatment to dampen the immune system's attack on the intestinal lining. Other immunosuppressants, like azathioprine, cyclosporin, or tacrolimus may be used as steroid-sparing agents or in cases where corticosteroids are ineffective or poorly tolerated. Nutritional support is also crucial to address malabsorption and nutrient deficiencies. This may involve a specialized diet, vitamin and mineral supplementation, and in some cases, parenteral nutrition, which delivers nutrients directly into the bloodstream. Regular monitoring of the patient's response to treatment and adjustment of medication dosages are essential to minimize side effects and achieve optimal disease control. In severe cases that are unresponsive to conventional therapies, stem cell transplantation has been explored as a potential treatment option, but it remains an experimental approach with significant risks. Currently, there are no known preventive measures for autoimmune enteropathy, as the exact cause remains unclear. Since the disease is thought to involve a combination of genetic predisposition and environmental triggers, avoiding potential triggers may be helpful in some individuals. Maintaining a healthy gut microbiome through a balanced diet and avoiding unnecessary antibiotic use could also potentially reduce the risk. However, more research is needed to fully understand the factors that contribute to the development of AIE and to identify effective preventive strategies. The prognosis for autoimmune enteropathy can vary significantly depending on the severity of the disease, the age of onset, and the response to treatment. With prompt diagnosis and appropriate management, many patients can achieve remission or significant improvement in their symptoms and quality of life. However, AIE can be a chronic and relapsing condition, requiring long-term immunosuppressive therapy and nutritional support. Some individuals may experience complications, such as infections, growth retardation in children, or the development of other autoimmune disorders. Recent research efforts are focused on identifying specific genetic markers and autoantibodies that can aid in early diagnosis and predict disease course. Additionally, studies are exploring the potential of novel therapies, such as biological agents targeting specific immune pathways or fecal microbiota transplantation to restore a healthy gut microbiome, to improve treatment outcomes for patients with autoimmune enteropathy. While there is still much to learn about this complex disease, ongoing research holds promise for developing more effective and targeted therapies in the future.